Good morning, ma'am. I'm Iris Quintatog from Tanduana State University, College of Health Sciences, BSN2C. So for today, I am going to perform the procedure regarding the donning and doffing of sterile gloves open method. So the purposes of doing this is to enable the nurse to move freely without contaminating the objects and to prevent the transmission of microorganisms from the nurse's hands to clients at risk for infection. Okay, so prior to performing the procedure, introduce yourself, verify the client's identity using the agency protocol, and then explain the procedure to the patient, what you are going to do and why is it necessary. Then after that, perform hand hygiene and observe infection prevention procedures. So assuming that I've already performed this, I'm going to proceed with providing client privacy by closing the door or sliding the curtains, and then after that is I am going to open the sterile package using the sterile method. Okay, so first is to open the sterile package without touching the inner package. And then next is to insert the first or your dominant hand on the first glove. So this is my dominant hand. So I am going to insert it on the right glove. Okay, so what I did is that I have inserted my non-dominant hand on the second glove, which is on my left hand. Now I am doing the adjusting for fitting until it fits smoothly on my hands. Okay, so now I am going to proceed with the procedure regarding the wound care. So the purpose of doing this is to prevent injury, to also prevent the spread and introduction of bacteria and microorganisms, to reduce discomfort and speed healing. So the first step of this procedure is to gather and assemble the equipment and bring them to the bedside. So since I've already gathered the equipments and already brought them onto the bedside, I am going to introduce the equipment. So this is the sterile forceps, the cotton ball soaked with antiseptic solution, the hydrogen peroxide, the absorbent gauze pad, and then the kidney basin, of course the micropore or the tape, and of course the gloves or the sterile gloves that is already in my hands. So next to that is to explain the procedure to the patient. So, sir, now I am going to mahari po ako ni dressing sa inyong lugad para po malimpihan ta and then masulitan ng bagong dressing. So, next is after that, I am going to do the hand washing, then position the client comfortably, and then place the waste receptacles within reach of work. So assuming that I've already performed the hand washing, I've also put on the sterile gloves in my hands. Now I've also positioned the client comfortably, and their waste receptacles are of within reach of work. So now proceed with the pulling of the tape or the removing of the tape. So in doing this, what I need to do is to pull the dressing, pull the tape toward the dressing, and dry, if over hairy areas, make sure that you pull the tape onto the direction of the hair growth. Now, now after that, I am going to proceed with, since with clean gloves, I am going to remove the dressing one layer at a time. So since this is just one layer, I am going to remove it and then observe for the appearance and the drainage on the dressing. Okay, so now what I am going to do is the inspecting. So inspect the size, the depth, the appearance, the drainage, and the approximation of the wound. Then after that, fold the dressing contained inside and remove the gloves inside out. And of course, we should discard it on to the waste receptacle. Okay, now, so since I've already removed the sterile gloves on my hands, I am going to use the no-touch technique for the cleansing and the applying of the dressing. So this is the sterile forceps, and using the cotton ball soaked with hydrogen peroxide, I am going to clean the dressing with each stroke or cleaning stroke at a time, and make sure that in doing this, I am cleaning the site or the wound from the least contaminated area to the most contaminated. Okay, so next to that is I am going to apply the antiseptic solution with the same procedure of technique as to the cleansing stroke. So this is the sterile forceps, and assuming that this is the cotton ball soaked with antiseptic solution, I am going to proceed with putting on the antiseptic solution. So using the same technique from the least contaminated area to the most contaminated, and each stroke should contain only one cotton balls. Okay, so I ran out of cotton balls, so assuming that this is clean and this is also soaked in antiseptic solution, I am going to continue with cleaning, with providing antiseptic solution on the wound. Okay, now I am done with the antiseptic solution. Now I am going to apply the dry dressing and then also apply the tape, and then after that I am going to do the hand washing. So this is the sterile gauze. So I am going to also use the antiseptic the forceps to put on the gauze. Make sure that I am using the sterile method also onto the gauze. Now I am going to apply the tape. So in doing this, make sure that I fold both sides of the tape, so for easy removal. So since I am done with applying the dressing, now I am going to wash my hands and then ask the patient to rate the pain. So sir, can you please rate the pain from 1 to 10? If it is 1, it is you no longer feel pain, and if it is 10, it is so painful. 1. Okay. Now, after that is I am going to do the charting, and of course, I am going to inspect the dressing at least every 8 hours. Thank you.